Hi everyone, welcome to the Synapse Studio. I'm here. I'm a medical doctor. I'm a neurologist, a movement disorder specialist. I'm here to talk to you today about the details about a brain disorder called stroke. What is stroke? How do we treat it? And what kind of specialists are involved in the treatment of stroke? That's what we're going to cover today. So first of all, what is a stroke? A stroke is basically a brain attack. It happens when there is an interruption of blood flow to a certain area of the brain, and that interruption can be because of a blockage or because of a bleed. So those are the two main types of strokes. One is called an ischemic stroke, which is a blockage of blood flow. The other one is called a hemorrhagic stroke, which is a bleed in the brain. The symptoms of a stroke can be very variable and they depend on the area of the brain that is affected. But some of the common symptoms are weakness or numbness on one side of the body, difficulty speaking, difficulty understanding language, dizziness, loss of balance, and visual problems. Now, if you suspect you or someone you know may be having a stroke, it's important to seek medical attention immediately. The sooner a person gets medical attention after a stroke, the better the outcome tends to be. Now, how do we treat a stroke? The treatment really depends on the type of stroke. If it's an ischemic stroke, a blockage, we may give medications to dissolve the blockage. We call those thrombolytics. Sometimes we may do a procedure called mechanical thrombectomy, where we actually go in and remove the blockage. Now, these are procedures that are best done in the acute setting, meaning the sooner after the stroke that we do it, the better the outcomes tend to be. There are time windows for giving those medications and also for doing the procedure. So that's why it's so important to get to the hospital as soon as possible. If it's a hemorrhagic stroke, a bleed, then the management is a little bit different. We may do an emergency craniotomy, meaning we have to open the skull to evacuate the bleed, and that's something that neurosurgeons do. In addition to the neurologists and neurosurgeons, there are many other specialists involved in the care of patients with stroke. There are neuroradiologists who perform the imaging studies. There are rehabilitation specialists, including physical therapists, occupational therapists, and speech therapists who help the patient recover from the stroke. It's also important to note that stroke is a medical emergency, but it's also a very common condition. In fact, it's the leading cause of disability in the United States. So it is very important for people to be aware of the signs and symptoms of stroke and to seek medical attention immediately if they or someone they know is experiencing them. Thank you very much.